So let me cover this one topic first. I had a client, chiropractor, who had attorneys sent out the attorney lien, and the attorney sends back and requests what his prices are, what is expected for the treatment protocol, and duration. And the client was a little surprised at that, and I'm like, well, I'm actually surprised more attorneys don't do that. And it's real obvious why the attorney did that. He's looking to, manage the case. He's not looking to have this case blown out of the water financially by a chiropractor. So, that's when we know that's what goes on. We have bad documentation with chiropractors and high bills. That's the common theme that attorneys know. So anyway, so he asked me, what should I do about that? I said, well, that's common sense. That's exactly what should be happening. And so how that's handled, it's just like you handle all your documentation. How it's handled is you let the attorney know that the case is based on the patient's test relative to the science of the three phases of healing. The three phases of healing are the inflammation, repair, remodel. The goal of the inflammation phase is to decrease pain, muscle spasms, and inflammation. The therapeutic goal of the repair phase is increased passive, active, and joint motion. And the goal in the repair phase, remodel phase, is to increase strength and elasticity. And it's based on the patient's biomarkers. And the two most common complicating factors are the patient's age. The older we are, we don't heal as quickly, and how long we've had the problem. And that's without knowing anything else about the patient. That's a very good summary of what you do and how you do it. And then just include your prices. So for the different services that you have. That's how straightforward it is. And that's another good reason why when you base your care and your practice and your patient education on the science of the three phases of healing, you have a real answer. You have the truthful answer to everything. All you got to do is just base it on that's exactly what you base it on. What are the patient's tests? Which of the three phases are they in? And what are some of the complicating factors? That's it. And then, of course, that's what your therapeutic protocol would be based on. And there you are. So it's great. It's fantastic. It's straightforward. It's reality. That's what gets your bills paid. That's what establishes the need for care, and gives a sense of reality to. And so I was surprised that more attorneys are not sending these types of forms out because of how bad, generally speaking, chiropractors are with their documentation being terrible for personal injury cases and their bills being skyrocketing. And of course, that's the number one reason attorneys ask to have you cut your bill. So it all starts with the bad documentation. But that's how that's handled. That's exactly how that's handled.